Hello everyone, we have very important gynae and obs question today. A 35-year-old primary gravid woman at 36 weeks comes to hospital for labor. She is having painful regular contraction. She has no vaginal bleeding and fluid leakage. She has no chronic past medical or past surgical history. Vitals at presentation are normal. Cervix is 6 cm dilated and 100% effaced, and fetal head is at 0 station. She requests epidural for pain control. Shortly after epidural, she feels dizzy. Her BP is 90 by 55, pulse is 120, and respiration is 15 per minute. What is the cause of hypotension? During the labor, sometimes the patient are given epidural anesthesia for the pain management at the L4 vertebral level or below the vertebral level, but it can cause blockage of sympathetic nerve fibers responsible for the vascular tone in lower extremities, resulting in vasodilation, decreased venous return, and decreased cardiac output. Therefore, many patients can develop hypotension and compensatory tachycardia. One thing we need to remember is that hypotension is a common adverse effect of epidural anesthesia if it is given below the L4 level. The answer over here is vasodilation and pooling. Sometimes it can cause brain stem depression if the epidural is given at above T4 level of the vertebra. We need to remember that it is also called high spinal anesthesia. At T1 to T4 vertebral level, it can cause hypotension, but there will be bradycardia as well. Similarly, if the epidural ascends upward towards C6 and C8, it can cause upper extremity weakness, and if it ascends further into C3, C5, it can cause dysphagia and respiratory paralysis. So whenever we give the epidural at L4 vertebral level, it can cause hypotension with tachycardia. The bradycardia will only occur if it is above the T4 level. Brainstem depression is not the answer over here. Anaphylaxis is not the answer since it does not cause anaphylaxis. Leakage of spinal fluid only occurs with the dural puncture. So the answer is vasodilation and pooling. Thank you.